pain management specialist, Dr. Askash Bajaj, joining us in our audience because we sent Faith to Mink Radiologic Imaging to get a cervical spine MRI. And Dr. Bajaj, what did Faith's MRI show?
The great news is, with Faith, her MRI is completely normal, meaning there's no nerve root compromise, there's no spinal cord abnormality. So that's very comforting. That leads me to kind of redirect my focuses towards more of a muscular issue. So really thinking more of a muscular spasm, a muscular strain, or a sprain.
And here's where I want to put your mind at ease a little bit. Modern medicine is not very good at treating things when it doesn't flash itself on an MRI, or they'll do, say, imaging and, well, we don't see anything wrong. But here's the deal. Your pain is very real. I empathize with you more than you realize. And so the reality is that there are treatments. So what kinds of things do you use that maybe could give Faith some relief?
So in a case like this, what I would consider is something like PRP, or platelet-rich plasma. So that's basically a fancy way of saying we're going to use your body's own healing mechanisms, its own repair factory to heal yourself. The procedure itself is very straightforward. We take a small blood draw, we separate the platelets from the other components of the blood using a special machine, and then we simply just take those platelets and re-inject them into the affected area.
So much of back pain is also, and part of this is as a doctor, but my own personal experience is, you know, I do probably 30 minutes a day of just rehab stuff to every single day of my life because of my issues I had. Is that something, will you work with physical therapists and rehab specialists? Because, you know, one of the realities is so many of the treatments, we can mask pain.
Sure.
But if your structure's a little off and your structure is such that you're just getting these repeated every day, it's getting worse and worse, which suggests there's a strain element.
Right.
Is that a big part of this too?
100%. So it's important for physicians like myself to work in conjunction with complementary practitioners, physical therapy, potentially chiropractic care, and maybe even lifestyle modification and activity modification.
So you're sitting here thinking, all right, I just want relief, right?
Exactly.
Well,
Sure.
Dr. Bajaj, I know you have something you'd like to share with Faith.
I do, Faith. So given what you've been through and given how much I think something like PRP might be able to help you out, on behalf of Remedy Spine and Pain Solutions, we'd like to offer you a complimentary session.
Thank you.
You're very welcome.
I'm so happy.
And in the meantime, we're going to watch along too, because we want you to look at everything from the pillows you're using to the bed you're sleeping on.
Yeah.
All of those things come together. But I just hope, Faith, that you found some answers today. We wish you nothing but the best.
I really appreciate it. Thank you, thank you, thank you, thank you.
You're very welcome.
Thank you.
By the way, what's your favorite ball that you use?
Tennis ball.
Tennis ball? So there are some actual formal therapy balls that you can order online.
Okay.
And this is, I'll tell you after some great ones, and we'll have a list on our website as well, because this has become, this self-care movement is what everyone is engaging in. I'm gonna share with you some balls that I use that I think you'll find superior to a tennis ball.
I'm looking forward to it.